Because of my heart condition, there are certain things I can't do, but the best thing I can do is at least take care of my mental health.
I definitely think having a heart condition has impacted my mental health. And I think when I was younger, I really struggled with it and I internalized, but now that I'm older, I can totally understand the trauma that comes along with having open heart surgery at like 2.
It's taught me a bit of discipline about how to deal with life, what life throws at you.
I think there's just this ingrained nature of resilience that goes, you've gone through this. There were times, especially in my adolescent period, especially with the scars, when there was a bit of woe is me. Why was it me?
My heart condition mostly has a positive impact on my mental health, but like, for example, when I'm going to surgeries or like if I'm going to like a camp or like just even a doctor's appointment, I think that can be quite nerve-wracking for me.
Everyone's problems in their lives are just as important to each individual person, but having that empathy was something that I really had to work on. And I only noticed it because I think my threshold of what was normal was just very different to my peers.
If you're not in the right mindset, everything becomes a challenge. Not having a good idea of what you want to do or how you're going to do something can really affect you and also the others around you.
I know that there are a lot of people with heart conditions, and I think I put myself in this category who kind of experience an advanced or an accelerated kind of existential maturity, in that you have to come to terms with a whole bunch of things. But for myself, I feel like I have tended to respond to some of those questions of kind of life and death that I've had to face a little bit earlier by trying to cultivate a kind of attitude of empathy, like you talked about, Rachel, but also of gratitude for what I've got.
Because I can take care of my mental health, I can do certain disciplines, certain activities and certain projects that make me a happy person.
I love walking, cold water swimming, seeing my friends. I'm definitely an extrovert, so I realised that that's where I get a lot of my energy from. And then taking breaks from kind of social settings, social media when I need it.
Sometimes you got to do the scary things. So I go to therapy and I talk about the things that I'm scared about, the things that make me anxious, whether it's work or friends or relationships. I try to face it in a way that I feel settled and comfortable and safe in.
When it came to performing, that was something that really helped me when I was going through a dark time. If you have that something that makes you happy, definitely go for it.
I talk with my family about my medical condition. Number 2 is I do what I love, so basically photography, a bit of math, I'll say. And the third factor is the amount of time I spend taking care of my health and researching how I can improve my health. Ways I can exercise, ways I can go out.
Meeting people with CHD has been just one of the most rewarding experiences in my life. It's kind of like when you see a family member or a sibling that you're really close with. Nothing is kind of off limits. You know all about their medical history within 5 minutes of meeting them, and then you just have this innate bond of shared experiences and being able to bond over nurses and hospitals. Half the time we've all had the same surgeon, and it's this weird friendship that gets developed because you feel like you've known them your entire life, even though it's probably been a 20-minute conversation.
You know, it's a good thing, you know, it gives me a sign where it's like I'm not the only person that is also going through this.
When I went to the HeartKids camp, I met some amazing, lovely people there with the same conditions and the same stories. And some of those people can do certain things that I doubt that I could do. But because of the people I've met down there, I've actually achieved that.
Being a community of people with heart conditions has actually been very beneficial for me.
I felt a sense of connection and like belonging. So many other people just like me.
When I've gone on events for HeartKids, I like chatting to the kids because learning about them and knowing that, yes, I'm on my own journey, but I'm not alone.
My name is Pat.
Hamish.
Frederick.
Rachel.
So
Deb McKellen.
Eve.
Verna Malhotra.
My name is Logan and I am a HeartKid.